Welcome to Deep Waves Transformation, where we dive deep into the realms of mental health, trauma recovery, narcissistic abuse recovery, toxic love relationships, and more. I am your host, Tasha Day, and I am here to guide you through this journey of awareness and healing. I am so excited to introduce to you today Jesseca Tighe from Colorado. She holds a PhD in psychology and is a life and leadership coach with Solutions for Health. Thank you so much for being here today. How are you?
Thanks for having me. I'm great.
Awesome. Well, let's just get started because I am super interested in digging into your brain about mental health and trauma and just the psychology behind it. What you know. Where could
Yeah.
we start with someone who wants to basically start a healing journey, someone who's felt so stuck in their lives? How do they move forward? What would you say?
Yeah. Well, I say that's the first step, just that awareness that there's something not right, something isn't fitting right. We were kind of talking before we started recording about our own personal journeys of just there's maybe a moment or a process of going through life where you just become aware, all right, I've had it and I want to feel different. I want to feel better. These survival mechanisms that got me through my childhood are not working in the regular world anymore. And I think that awareness is really the first step. And that's where, people, I think, find, both of us is, they just start researching about what can I do and what is this and what flavor of craziness is this and how did I grow up and how did that, just asking those questions and gaining that awareness, I think, is the first step towards recovery.
Absolutely. What are some of the mechanisms in your body that you were feeling or that you
hmm
felt when you're experiencing something traumatic? And
yeah really long-term trauma, I find, most commonly manifests as some kind of stress response, and some kind of repeated stress response. And so what I try to do in my work, when I'm working with people is, saying like, look, every emotion has a reason and it has a purpose, even if it's super annoying and we don't like it. We think of stress as something that we can just get through and push through, and everybody has stress and everybody has problems and it's not a big deal. But really that stress response is telling you that there's something wrong. There's something that you need to work through. There's something going on with you. And so creating that awareness around, all right, there is something wrong. So let's take a look at why it's here and what it's telling you. And I think that that's really the first, step for people, is to actually see stress as a signal instead of an annoyance that just needs to be swept under the rug or something that can be easily over. Because that's not true. And especially for people that are experiencing trauma and re-experiencing trauma in their life, because that's just what happens when you don't deal with it. It keeps showing up and knocking on your door, and you have to let it in and deal with
right. So that's what I was going to ask you about, as well as how do you deal with certain triggers?
it.
If
Yeah. So it really depends on what those triggers are. What I usually try to do with my clients is we identify triggers that are really causing health problems. Some people can, come to me for all sorts of reasons, but if they're experiencing something like panic attacks, if they're experiencing some, physical symptoms like, severe weight loss, weight gain, eating disorders, like if they're experiencing some huge physical symptoms, I like to deal with those things first. And of course, we deal with the emotional stuff. That just is part and parcel. But I really want to get those symptoms under control pretty quickly, and so that they can get some relief, A, and B, so that their body can really start to calm down and feel what it's like to actually deal with some of those symptoms. And then you have the actual space in your body and your brain to do some of the deeper work.
Right. Yep, absolutely. So would you agree that we hold a lot of trauma in our stomach, in our gut, and that travels through the vagus nerve, and until we can actually get that vagus nerve reset,
Yeah,
that's really kind of where it starts, is in the body, not the mind. Right.
absolutely. Oh, absolutely. Yeah.
Yeah.
And that's what I mean by stress response. Of course there's, thoughts, there's ruminating thoughts there. We try to think ourselves out of these situations and it's not working. But really it's the physical symptoms, that get people to my door. Because those are the ones that are the most painful. And yeah, the basal vagus nerve is huge, for
Mhm.
people with that trauma response. And it's also continuing to realign and continuing to do those exercises, because the survival mechanism is so ingrained in people who are dealing with childhood and ongoing trauma. You really have to continue to attune these things in your body, and it's a continual practice, throughout your entire life.
Right.
And
Possibly the practice of manifestation.
yeah,
I
yeah,
did a lot of
absolutely.
these, which really helps you guys. It really helps you rewire the subconscious. What things that you've been told your life, you're not good enough, you're this and you're that. All those negative thoughts that you've been told from other people that have basically dictated your life for you. We've got to
Uh-huh.
do the work and re-brainwash our subconscious. And the only way to do that is through affirmations
Yeah,
and manifestation.
yeah. I completely agree. I mean, they call them ants for a reason. Automatic negative thoughts. What do you
Yep.
do with ants? Yeah, gotta squish them.
Yeah,
Yeah,
exactly.
yeah.
Would you say that it's hard to trust people after you've been through a lot of trauma in your life?
Oh, of course. And because the survival mechanism is that, oh, well, I can't trust anybody but myself. Because when you're born and bred to be both the problem and the solution, then you can only trust yourself. And it is a huge practice to start trusting other people, but also to let go of that people pleasing aspect of yourself. That's what a lot of my clients have to work through, is that people pleasing, because, that's an element of control in itself, because you're
Mm.
trying to control the outcome, you're trying to control others, you're trying to control the situation. But
Yeah.
that's okay. That's what you were taught to do that's what you were taught to do when you were a kid. And when you start looking at those survival mechanisms that are no longer functioning in a healthy relationship and a healthy society, then you can start to slough those off and let them go. But that is a huge aspect, is letting go of that people pleasing and just trusting others, but also assigning the proper meaning to what they're actually what those experiences actually are, instead of saying, oh, this person's judging me because they looked at me the wrong way. Like, no, you don't know that.
Yeah.
Let's assign the proper meaning to things, and then you can start to not only trust others, but also yourself.
Yeah, because you could easily self-sabotage any relationship that you go through because of your trauma. Like it's nobody else's
Um,
responsibility but our own to really heal. So
right,
when we get mad and we get upset at somebody and we're projecting onto them, it's really us. It's not
right,
them. It's like, and then you
absolutely,
feel so bad after the fact. And it's like, that's when we get to the point of, okay, I got to figure out this is not working for me. This is not working.
absolutely,
So
yeah.
I gotta think of a different pattern that I can use to not self-sabotage my relationships anymore because of my trust issues.
Absolutely.
Yeah.
Absolutely. Well, and you don't know why you don't even label it as self-sabotage. You're like, why isn't this working?
Yeah.
Like,
Yeah.
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 Tell me what you know about personality disorders, like specifically narcissistic personality disorder versus bipolar disorder. Tell me what you do.
Yeah.
Yeah, did you
So
ever experience a relationship?
Oh, sure. Yeah. Yeah. So, well, there's a couple of different things. So, like personality disorders and mood disorders are completely different. So, if you, in this example, if you're looking at narcissistic personality disorder or, bipolar disorder is a mood disorder. Personality disorders, that's who that person is. They have a set of traits. They're extremely inflexible and they follow that person throughout their life, and they're just extremely difficult to treat. Um, these are folks that, especially for narcissists, borderline, um, those people are built to basically say like the world revolves around me, and whatever happens, it's your fault, it's not mine, and that is who they are. There is not a medication for them. There is treatment, but it's really difficult to get these people in treatment. Um, they usually have some kind of interaction with the criminal justice system, and then they might be compelled to seek some type of treatment, and it takes years. Whereas someone who has bipolar or depression or some kind of mood disorder, there's medications for them. I just one of my favorite supervisors of all time used to tell me, you can kind of tell the difference when you've got someone in front of you who has a mood disorder versus personality disorder because of what happens in you. Like you can look at someone who's having like a depressive episode or, is bipolar or manic, and you can kind of take a step back and be like, ooh, they're having a manic day today. Ooh, they're not doing so well today. But when someone has a personality disorder, you have the reaction because that's who these people are, is they develop the reaction in you so that they can control you. And that's a huge difference. And I swear that piece of advice works every single time. Like you can be standing in the middle of Starbucks and be like, there's a borderline right over there.
Yeah, absolutely.
Yeah.
The more
Yeah.
educated you become about personality disorders, the more you can spot it out there. So my
Absolutely.
stay informed and stay educated, you guys.
Yeah.
Definitely. Have you ever
Absolutely.
experienced a narcissistic abusive relationship?
I am the daughter of a narcissist. Yeah. Yeah.
Okay. Very
So my mom, I believe, had narcissistic personality disorder. Of course, she was never diagnosed. Never got treatment. Nothing like that. Because she didn't need it. It was the rest of the world's fault.
There's nothing exactly.
Yeah. So I mean, that's just the so. Yeah, so I grew up as a child of a narcissist, and these things that I'm talking to you about, the survival mechanisms, I was both the problem and the solution, and I was her only child too, so there was nobody to share the blame.
Okay. Okay, so
And
that's harder.
yeah, nobody to share the blame, and I grew up on a isolated farm out in western Colorado, and so there was also just nowhere to go.
Yeah.
So I developed some, really maladaptive coping skills that I didn't understand until I was in my 20s and actually started to go to therapy and do workshops and really started to work on myself when I started to realize like, oh, I have all of these maladaptive coping skills that worked really well for growing the way that I grew up, but they didn't work well in actual
That makes sense.
relationships. Yeah. And
Right.
because I don't have a personality disorder, and I
Right.
wasn't dealing with other people. I didn't want to be in unhealthy relationships. I wanted to have healthy relationships. I wanted to, be quote unquote normal, whatever that means.
Yeah.
Normal-er.
Yes.
Because that was what I wanted. I really had to work on myself so that I could attract those types of people and relationships.
Right. What were
So,
some of your coping mechanisms as a child versus today as an adult?
control. I would have, if you would have asked me before treatment, I would have said, oh, I don't control any. I totally was. I was very people pleasing, which is controlling. Now I understand that.
Yeah.
I thought I had to manipulate certain situations and people in
Mm-hmm.
order to gain a certain outcome that was favorable to me. I thought that's what everybody was doing.
Yeah.
I saw people and situations as chess pieces on a chessboard, because that's how I grew up. Because you had to be responsible for, I had to be responsible for my mom's mood and attitude. And otherwise, it wasn't safe. It wasn't predictable. I had to, I had to learn, I had to unlearn all of the stuff and just say, what people think of me is really none of my business. I don't have to do these people pleasing behaviors anymore because it doesn't matter.
Right.
And and all of this energy that I was putting into those exercises, now I'm putting into healthy things. And there's still stuff that happens. My mom actually passed away this summer, and I all of that stuff kind of came up again because anytime the thing with trauma and people don't realize is that you don't just deal with it. Every time you hit a milestone or something happens in your life, you have to reorganize that trauma and put it back on the shelf inside you. And it reorganizes itself, and you have to continually do that work.
Right.
And I think that's a huge piece of advice. It's not just like, oh, I went to therapy and I dealt with it. It is a lifelong recovery process. And as you hit these milestones in life, you really have to reorganize that trauma and what it means to you. What it means to you, like when I became a mom was another big one.
Yeah.
Still like when I hit 40, when I hit 45, when there's certain life cycles that happen, you really have to take a look at it and what that really means for you. It's new.
Right. What advice would you give to others who are dealing with any kind of trauma, whether it's sexual, whether it's narcissistic, whether it's mental, physical, whatever the kind of trauma it is, car accident even. What advice would you give to those that are struggling so bad right now?
I mean, talk to someone. I talk to someone is the best thing. And if you're not ready to work with someone, if you're not ready for therapy, if you're not ready for coaching, I mean, I would say, work with either one of us because this is what we do day in and day out is help people through it.
Yeah.
But I would say, talk about it, talk to someone, and find that, that closed mouth friend or that safe person that you can talk to, at least to let a little bit of that steam out.
Yeah.
That's huge. And then, doing things for yourself that are good, journaling, self-reflection, going and actually talking to a professional. A lot of people that work with me have been in therapy before and they're like, but I still have all these symptoms that I'm dealing with. And I just don't think talk therapy traditionally, like it was great and it served its purpose, but I still
Right.
am having all these symptoms that I need to manage. And a lot of people come to work with me because they're still experiencing those symptoms and they want those skills. So, find something that you're comfortable with doing so that you're at least working and growing, because otherwise it's just a cancer that infests
Right.
and it just gets worse if you don't deal with it.
And knowing too that there are many options available today as far as healing trauma today versus then, like
Yeah.
understanding where trauma comes from, like I said earlier, the gut and how it affects the mind. And there's other therapy slash recovery journeys that you can go on. For example, somatic therapy,
Mhm.
the good
Mhm.
one.
Yeah,
Spinal
huge.
energetics. I mean, these are all new, powerful recovery journeys that I'm hearing about, and it's not taking very long. It's taking between 6 and 12 months versus, like you had said, I am still dealing with this trauma from 18, 20 years ago. And
Yeah.
here's a medication that I'm going to be on for the rest of my life. Like, I don't agree with that.
Yeah.
I agree with getting more educated and finding out really how can we heal other than calling your doctor and saying I need to get on a prescription. No, there's some other options out there, guys. Healthy.
Absolutely.
Yeah.
Yeah, absolutely. I mean, and trauma is so misdiagnosed as other things.
Yeah.
And also, some of these medications people do have to be on, and it's a lifelong journey. Like, I'm not saying that there's not a place for it, but I am saying let's get a proper diagnosis and put it in its proper place. And yeah, there's so many things that you can do that these, pool healings really do make a difference. And I mean, my program's 4 months long, and then I go month to month with people. It's very short acting, and it really doesn't take a whole lot if you're willing to sit down and do the work,
Exactly.
which a lot of people are because they want that relief.
Yes.
Then you can experience some healing very quickly, and it's just amazing to see that transformation in people.
Absolutely. Okay, so if someone is not feeling safe in their body
Mm-hmm. Mm-hmm.
due to
Yeah.
trauma, how do we deal with that?
Yeah. Talk to someone. So, if someone's not feeling like, if they're feeling like are you talking about like self-harm?
No, just kind of
Okay.
feeling dissociated.
Oh,
Dissociation.
okay.
Yeah.
Yeah.
Like
Yeah.
disconnect from our bodies. Yeah, yeah.
Yeah. Yeah. So dissociation is huge. It's a survival mechanism. Um, it, listen, let's honor it for what it is. It served you well as a
Mm-hmm.
kid. I dissociated when I was a kid. I had huge, a huge imaginary life.
Yeah.
I still kind of daydream and can kind of go off in my own little daydreams, which, I love my daydream.
Yeah.
But it is a survival mechanism, and it's not the real world. And so what you can do is label it for what it is, honor it for what it is, and make a practice around it, put it in its proper place, because those things don't necessarily go away in the brain. But maybe it's okay if you like zone out when you're working or exercising or something. Put it in its proper place, and then don't believe the stuff that comes out of it, because the one thing that a lot of people that suffer from childhood trauma, one through line is that we can overthink and analyze
Like
the
crazy.
Olympic style. Like no one can overthink me. Like
Like, seriously.
yeah,
It's
but it's frustrating, but also don't. It is part of that survival. It's
yeah.
right. It's okay. What can I do in order to make the situation better? Like, I can fix it.
Mm-hmm.
But really putting it in its proper place and not attaching to that. Like, it's okay to think through things. Journaling's really huge, because then you're not, just continually going over those mental gymnastics. You're getting something down on paper, or on video. We talked about video journaling,
Yes.
before we started recording, which is
Yes.
awesome too. Like, any part of that practice that can get those words out of your head and actually slow that thinking process down, you can get that on paper or get that on video, and really start to actually look at the problem for what it is, and just not attaching to some of those mental gymnastics that you're doing, or some of those fantasies like, oh, if I do this, then this will happen. That's control. That's control, and you're not in control.
I live by the motto, no expectations.
Yeah.
That really seemed to help me not deal with disappointment from people and rejection and the abandonment and all those issues that it creates. Just go with the mind thinking no expectations. Don't expect it.
Yeah.
Just know that you've got you, and you'll always have you. Like, you've got to put you first. You really do.
Absolutely. Yeah. one of those sayings that I like is expectation is just a resentment waiting to happen.
Exactly. Oh
Yeah.
my God, I'm so glad you said that because yeah,
Yep.
if it doesn't happen, then we in turn start to beat ourselves up. And it's
Yep.
like we shouldn't have even we just self-sabotaged our own self. We shouldn't have even done that.
We
So
did. Yep.
mm-hmm. How would you deal with setting boundaries after you've been through narcissistic abuse or any kind of
Yeah. Yeah. So, well, I'll just talk about myself,
yeah.
first. So when I was setting boundaries around my mom, um, she didn't need to know that. She just a couple of examples. She started drinking pretty heavily when I was in my 20s, and maybe she always had, and I just didn't notice. I have no
Right.
idea. But I wouldn't call her after 5 o'clock because it's not a comfortable conversation. Um, and when I would go see her, I would say, all right, I'll go see her once a month, and because she, lived very close to me,
Mm-hmm.
and I'll go see her once a month, but I'm not going to stay past 2 hours. I had these boundaries for myself where I was comfortable engaging with her. And then when I had my son, and I'm her only child, so that was really her only grandchild.
Mm-hmm.
And I didn't want to cut that. I didn't want
Bond.
to. I didn't want to cut that bond, and
Yeah.
I'm glad that I didn't. But I had these boundaries around it, but she didn't need to know that. I didn't need to share it with her. She wasn't going to understand anyway.
Mm-hmm.
So for me, it was really figuring out what am I comfortable with? And then if it ever got uncomfortable, well, I can always dial it back more.
Right.
And near the end of her life, it really started to get uncomfortable. I don't know what was going on medically with her, mentally with her, but things got really, really bad in our relationship. And I'm sorry that happened before she died, but it I'm not the one that changed the relationship. She did.
Right.
And I've got to I've got to assign the proper meaning to that because that really is what happened. I reacted in the way that I felt like I needed to keep myself safe and my son safe. And there's nothing wrong with that. And
Yeah.
that's on her. Um
Exactly. They've pretty much
yeah,
set the boundaries for themselves. We just
they kind
have
of do.
to realize that we
Yeah.
have to set the boundaries with these people.
Yeah, yeah. Well, I mean, she loved it because she, got to, wallow in the, oh, I'm being treated so badly, and my daughter doesn't love me or whatever, and she, they love to be the victim. So,
Oh,
yeah,
absolutely. It's reactive abuse that they're looking for, right?
absolutely, absolutely. It's like, no, that's just a boundary because you're being kind of nuts right now.
Yeah, exactly.
Yeah, yeah, yeah,
That's unfortunate. What's
yeah.
your perspective on the stigma surrounding mental health right now? Because
Oh, it's
it's
better.
booming today. Like I feel
It's
like this
yeah.
generation is hurting so bad that we're actually
Mhm.
wanting to seek help.
Yeah, it's way better than it was for sure. I think we still have a long way to go.
I do.
But I do love seeing, ads for BetterHelp and Talkspace, and I love seeing all the wonderful coaches that are coming out of training programs now. All of the different types of healers that are in the world. It's no longer this stigma and this woo-woo thing. Everybody I talk to, especially, it depends on the area. I'm in Colorado, so everybody's got a therapist and everybody talks about it and it's fine. Um, so, we all have a therapist, a personal trainer, and a life coach, and we have all the things. Um,
Awesome. I love it.
yeah, yeah, it depends on where you are, but I think it's wonderful to see that that stigma is changing. I would love to see more wellness in the workplace and not just like here's the EAP phone number in the break room.
Right.
But, that's something that I try to teach in when I do leadership coaching, is around actually creating, wellness that actually works, and not just, we're going to serve apples today instead of candy. And here's the phone number for a 12 session.
Yeah.
I think that that's the next frontier, is really breaking that stigma and talking about, mental health and wellness at work. But it's so much better than it was when I first started practicing, when I first graduated from school. It was still really highly stigmatized. It wasn't something that people talked about in their daily life.
And it was almost
Yeah.
embarrassing if we had to say that we're on a medication. Like, that was embarrassing.
Yeah.
We all be comfortable in it. It's okay, guys. We're not perfect. And I mean, we all experience
Yeah.
something in our lives, and you should not be judged for it or criticized for it. We just have to understand that we have been through a certain trauma, and how do I heal from this, and not
Absolutely.
continue to project it onto the world and other uncertain people out there.
Absolutely. Absolutely.
Yeah.
Yeah.
I'm curious, who have been some of your like role models in the field? Do you have any like actors or motivational speakers out there that you?
Oh gosh. Yeah, well, I love, one of the things I love to do is read. I used to escape into books, and I still do. Actual books, like with paper. And I still do that. But my biggest mentors have been people in my real life. I've had a couple of supervisors who I still quote all the time to this day. I have a couple of times in this podcast. And just, I have real life mentors that were just, really, really amazing human beings, and, really helped me grow and learn. I love the self-help world. I love the self-help books. I love all the healing stuff. A lot of really cool things are happening on YouTube. I have an 8-year-old, so I listen to podcasts with one earbud in. I totally do that.
Nice. Yep. That's where we gotta start, man. That's where
Right.
that's Jessica started, is read. Go to Barnes and Nobles and get some books, and open up YouTube. Listen to the podcast. Let's
Totally.
grow. We gotta do better.
We gotta do better.
Well,
And
we gotta break those generational chains. And then where's it gonna
yeah.
start? You know?
Yeah. Well, it starts with us.
Exactly.
Yeah, it starts with us.
Yeah.
So yeah. No, I love it all. I love exploring. I can't really think of necessarily like, oh, you've got to read this one person. Because I'm just continually engaging with that type of content, and I love it. It helps me grow and learn. Someone will say, oh, read this book, or read this blog, or watch this YouTube video that this one person did, and so it just becomes this kind of spider web. But that's part of my growth and healing.
Same.
And
Yeah.
it's great. I love it.
I'm feeling a certain type of way, it's like, Google, here I come, like, and then it'll just like, or what is NPD, or what is BP, like, and it just goes, and it just goes, and you keep learning.
It does. Keep doing it. It's so important.
Is there anything else you'd like to share with us today? It's been such an awesome conversation. I love having you here. This is great.
Yeah, you too. This is great. I mean, talking about, mental health and wellness is literally my favorite thing to do. So I appreciate the opportunity to be here. And yeah, if people are interested in, more support from me, you can find me over at Solutions for Health, SOUL. And Jesseca Tighe, and I'm on Facebook, LinkedIn, all those things. So message me. Yeah.
Awesome. Okay, well, that is all we have for you guys today. Remember, your journey to healing starts with understanding. Stay strong and stay informed. Every step towards awareness is a step towards freedom. Until next time, keep riding the waves of transformation with us. I'm your host, Tasha. Have the most wonderful day. Thanks, Jessica. Have a good one.
Thank you so much.
Of course.
You can visit Jesseca at solutionsforhealth.com and on her Facebook and Twitter at Jesseca Tighe. For more information on how to find me, please visit deepwavescoaching.com and on my Facebook and Instagram at Deep Waves Life Coaching.